Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
I'd like to thank you for joining us tonight and for continuing to share and participate in our monthly meetings as we continue to support and advocate for better care for people with the risk of heart disease, diabetes, and cancer. Tonight, we have a special guest here with us tonight. We have the host that's going to conduct the health coach training and certification tonight. That will be presented by Ms. Susan Butterworth, Associate Professor and Director of the Patient Engagement for the Center for Health System Improvement. And along with Ms. Butterworth, we have Ms. Joyce Brown. She's a community health worker and health coach. This session will explore the opportunity for health coaches in Tennessee, and as well as will provide information about the training and certification progress in the state. Joyce Brown is a recent graduate of the UTHC SC, and she's a health coach certification program. Will share her recent experience in this field. So we are all set to go. We are glad to have you here, Ms. Butterworth and Mrs. Brown.
Well, thank you so much, Ms. Ruthie, for that kind introduction. And I'm happy to be here with everyone as well. Before I go into my PowerPoint, I just wanted to invite you to ask questions as we go along. Let me know if you're particularly interested in something. I'm not going to go into a lot of detail on some of the technical things like research, but it's available here if you want it. I'm also interested, we've got Joyce Brown that's going to talk to us about her recent experiences as a health coach, but I'd also love for any of you to talk about your experiences in health coaching. And it doesn't have to be formal. It can be informal or it can be formal. So I'm going to go ahead and share my screen. So I have a question for you, and you can use your chat function if you know how to use the chat, or if you know how to use the reactions. You can also use the reactions and just give a thumbs up or thumbs down, or you can just type in 1, 2, or 3 into the chat. It's up to you. But I want to know, in your opinion, are you a health coach? Well, that's a good, robust response. And so that's not a trick question, but I want to say that for those of you that said no or maybe, I want to let you know that, again, this does not have to be formal. So if you have used some communication and strategies to work with a family member, a friend, a colleague, a client, to try to engage them and guide them towards a targeted health goal, a behavior change, maybe following their treatment plan, maybe it's just following through on a referral. If you've done any of that and worked with someone, you have been doing health coaching. And so I would say that at various times you have functioned as a health coach. So this is something that we can do regardless of if we're doing it formally as a job or just sometimes. I'm speaking to the choir here, but let's make a little bit of a case for health coaching. The percentage of overall health determinants that are lifestyle related are 40 to 50%. So lifestyle matters an awful lot. Over half of us have at least one chronic condition, and 27% or more have multiple chronic conditions, no matter what age. The average number of prescription medications for people that have 3 to 4 chronic conditions is 24. Imagine keeping up with all those medications. And we spend so much money on the cost of chronic conditions and chronic disease. And it's really hard, again, for people to manage. Well, you would think that this would be something that our primary care doctor could really kind of address, but they only spend about 16 and a half minutes with their patient. It takes them longer to fill in their charting, to do their documentation. So they really need help. And there are right now, we'll talk about these billing codes that allow health coaches without a medical degree or community health workers to have coaching sessions and actually get some reimbursement for the clinic or the agency if they have a doctor that's overseeing them. So it's premature and early now. A lot of clinics don't have health coaching, but many of them are starting to look at it. Many of them are starting to hire them, as well as a lot of our community organizations. And so there's a big case for health coaching because, you know, people need a lot of help, and the doctor does, and or the nurse does not have time to provide them with the amount of time that it takes to change a really difficult behavior. So I'm supposed to talk about health coach training, and I definitely want to do that. But I want to talk first about all the things that health coaches do. It sounds like something that would be fairly easy. You just, you know, give someone information, tell them what to do and how to do it, and they do it. But we all know that that's not enough, that people need way more than advice or information, and scare tactics don't work for most people. So as a health coach, we need to really learn about motivation and how to help people with self-awareness and self-efficacy, which is just a fancy way of saying their confidence in doing something, their resiliency, their toughness. We have to understand how to help people dig into that. Yes, we do help them with knowledge and resource awareness, but it's also about helping them find social support, helping them with problem solving, helping them kind of look at their own feedback of their own patterns and their own day and habits to help them. And then also really helping them commit to making some of these tough changes. There's a lot of health coaching theory and framework, and I'm not going to go into all of these, but I do want to say that there's a whole body of science and research for the past, 60 or 70 years that has been studying why people change, what helps them, and what we can do as health coaches in terms of some strategies and ways to communicate with people. So a lot of you have probably heard of motivational interviewing. Right now, it's considered the best practice for overall communication. So if we're going to communicate and we want an evidence-based approach, motivational interviewing is considered the approach that's been fully described. It's standardized. We know how to measure it. It's been associated with outcomes, and it is very patient-centered. It's collaborative. It is goal-oriented. There is targeted behaviors. We don't just follow, but we help guide. And it's intended to help people figure out where their ambivalence is, like, I want this, but I also want that. I want to manage my weight, but I love hot fudge nut sundaes. And I know I should exercise, but when I get home, I'm tired. I'd love to quit smoking, but how else do I change my mood state in 15 seconds reliably every time? So we have competing interests and priorities. And so this is intended to help people figure out what is their motivation and commitment to change, and how can they get through that ambivalence. And we do that by focusing on their arguments for change. So why do we choose motivational interviewing? Well, there's lots of research. There's over 1,800 clinical trials. In one study that I participated in, we increased enrollment by 4 times more than using other types of approaches. It's the only one that has got standardized and validated assessment tools. In other words, I can watch a session with a health coach and a patient, and I can measure how well they did with motivational interviewing, which allows me to give them feedback and to mentor them. This has been studied a long time, over 40 years, and there's structure. We can help people whether they're having a 5-minute session or a 50-minute session. And we know that they have to go through these 4 tasks: engaging, focusing, evoking, and planning. It's also being taught now around the world in over 52 languages. And so it's very common now, if you talk to health coaches all over the world, to find out that they've had at least a little bit of motivational interviewing. And I know some of you here have taken motivational interviewing. So I also wanted to talk about advanced health coaching strategies, because it's not enough to just know motivational interviewing. It's not enough to just be able to engage people. If we're going to be a health coach, we really need to understand the chronic conditions, the lifestyle management techniques. We also need to help understand a little bit more about behavior change as it presents itself with a chronic condition or trying to change a health habit. So one of the things we can do, and this is pretty common, is to elicit client narrative. In other words, what is this person's story? If I'm not curious, and if I don't pull out their perspective and their unique situation, there's no way that I can help them try to brainstorm the most relevant and realistic ways that they can change. So I want to really understand and assume that everyone's unique. They all have their own story. And it's not, maybe I've done a whole lot of health coaching, but I can tell you that after 40 years of doing this, I'm telling you my age, I meet people all the time that I never would have guessed what's holding them back and what motivates them. So if I want to know, I'm going to ask them to tell me. Obviously, you've heard about open questions, asking people tell me what, how. And in motivational interviewing, we do that a lot during the engaging and the evoking phases. So I would say this is definitely a health coaching strategy, but it is very fundamental. One that's probably not taught as much as I would like in classes for health coaches is teaching them how to guide their clients to insights and pattern recognition. In order to deeply understand ourselves, we have to track what we're doing. We have to understand what are our habits and our tendencies, and what are our prompts and our cues. And so, for example, something like eating, keeping a food journal and looking at our moods and how we feel before and after what we're eating. And once we do that, we can kind of learn and have self-discovery. And so a coach can encourage this self-discovery, and they can really elicit and evoke what the client has learned from their past efforts, from their tracking, and also from their wishes and their wants for the future. We really need to promote and support resiliency and sustainability. And I think the COVID pandemic taught us a lot about that. It taught us about the resiliency of our communities, of our families, and of ourselves. But we've always needed resiliency to deal with life stressors and family issues and personal journeys. And we also need it when we're going through, difficult behavior changes, especially if we're dealing with a chronic condition. So we want to really, use types of strategies and tactics that help people realize how strong they really can be. And we can do that by reframing their, what they'll call their failures as, hey, this is just trial and error. What you're doing is you're trying things out and you're learning. And so we're not going to call it successes and failures. We're going to say, gosh, look how much you've learned. You know what doesn't work for you. You know what does work. We also want to encourage them to be sustainable. So I don't want someone to depend on me as a health coach. I want to teach them how to problem solve. I want to teach them how to build in their own accountability, how to find their own social support, so that when I'm not with them, they feel confident that they will continue on their path and continue to set goals and to reach them. And part of the way that we do that is we create habits and rituals. Does anybody know the difference between a habit and a ritual? This is a pop quiz. Anybody can answer. You can guess if you want. What's the difference between a habit and a ritual? Does anybody think they have a ritual?
Well, I'll take a guess and say that a habit is something that you repeat naturally because you've done it this way for so long. A ritual is something that it may not be as habit forming. It's something that you see or have read that ought to work. And so you just kind of step into it for a while just to see if you get some results.
So I love what Sandra has said about the habit, because that is something that you don't have to think about. You brush your teeth the same way. You put on your clothes the same way. You drink your coffee at the same time, or your evening tea. So if we can help people create habits from their, exercise and stress management and eating and sleep and that type of thing, that can be really good. Now, she said ritual is something that you kind of have to consciously seek and consciously do, and that is true. I'm going to add a little bit more to it. A ritual is a habit that you consciously and deliberately do because you find pleasure and connection from it. It grounds you, it brings you joy. And so one of the things that I wish we would teach our health coaches more of is helping individuals link some of their health habits that maybe aren't as pleasurable with something that's very pleasurable. And if you link them together, you can create a ritual. So I'll give you one example and then see if you can think of more. Somebody really treasures a friend. They find deep connection with that friend, and they agree to walk 3 times a week because they're working on their exercise. So now they can look forward to it, and the ritual is having the deep friendship along with the walk. So it becomes more than a habit, it becomes a ritual, something that brings them joy that they look forward to. Can anybody think of another way that you can create a ritual that helps you be healthier, but in a way that you can find peace and joy from?
Celebration of family. We get together on holidays. We're lucky enough to all be close to where we can do that. And that's sort of a ritual with our family. And I guess you could also call it a habit because it's almost always the same holidays that we do that. But it does bring pleasure.
Yes, and it's social support. It's family and social support. It's a community. It's a network. It's a sense of belonging. And so I would say that absolutely that would, to me, rise to the ritual. And it's helping emotional and social health. Absolutely. So this is just an example of how, as a health coach, we can be really focused on the facts of healthy eating or exercise, but really we have found that what helps people stick with it the most is when they can understand themselves, their insights, their patterns, and then we can help them with this resiliency and this sustainability. We all know about goal setting. And the thing about goal setting is, yeah, you can use SMART goals if it's appropriate, But I think that more important even than that is realizing that people set goals differently, and we want to be open and help people explore. Sometimes small baby steps works for people, but I've worked with people that said, I'm an all or nothing person. So this small baby steps is just not meaningful to me. When I make a change, I make a change, big sweeping changes. And as health coaches, we're kind of taught, oh no, don't do that. So my advice to you in terms of thinking about working with someone on goal setting is find out what works for that person. It doesn't matter if it's small or medium or large, and maybe they'll change it up. But one size definitely does not fit all. And lastly, there's something I just want to mention because it's thought about that we do this in counseling a lot, and it is. Cognitive behavioral therapy is the most common strategy that's used in counseling, but there's a part of it that can be used by lay people. And it can be used in health coaching. And we don't train health coaches in this enough, but it's called cognitive restructuring. And we want people to understand the whole concept of what we call cognitive errors. When our brain has gotten stuck in a way to where we can do things like all or nothing thinking. And these cognitive errors can harm us. Sometimes we only look at the negative, not the positive. You've talked to people that kind of get into this pattern of feeling like they're not good enough, so they do this self-talk to themselves, or they don't feel like they can be successful. So when we find some cognitive errors that are repeated, it can be helpful to help the client identify those and help them identify those negative thoughts and replace them with more positive ones. And there's a big body of research on this. There's a lot of journals and workbooks. And again, we're not trying to become counselors. We're not talking about family of origin issues, or we're not talking about addictions. We're just helping people to recognize if they have patterns of thought that tend to be more negative, is there a way for us to replace that thought with something more positive? I'm going to pause here because some of this may be new information for you, and I want to give you a chance to either make a comment or ask a question on it.
So, somebody on the chat, it's saying, create a new brain pathways.
Yes, exactly. That's exactly what's happening, because your brain can get in a rut just like we can with, subconsciously doing everything the same way. Your brain can get stuck with that as well. So we want to interrupt it. We want to train it just like we train our muscles. We're going to train it to do things, to think in a different way. And again, we know it works because it's used in counseling all the time. And there's been there's been some work with having lay people and non-clinical people use this very successfully, again, just in the manner that we would do any type of health coaching. So I want to say that for non-clinical health coaches and community health workers who are working in the clinic setting, they may need additional training. They may need to learn more about, chronic conditions, being a patient advocate, administering an assessment like a social determinants of health assessment. They need to provide resources and referrals, which means they really need to be plugged into the community. They need to learn about diabetes management. Gladys is an expert in that. Smoking cessation. I'm involved in a program with independent aging, teaching people how to age so that they're independent longer. And it looks like Kimberly has a question or a comment. Or maybe her hand's up by accident, which is okay too. All right, I'm going to move on, but Kimberly, if you want to comment, the floor is yours. So this is the section I'm not going to give to you in detail, but I want to just provide it because you may be working with a clinic or an organization, and they may say, well, give me the evidence. Show me that this works. So for motivational interviewing, there's over 1,800 clinical trials. I just cherry picked, and you can get a copy of this if you would like. But this just tells you, like, if they're, whatever they're interested in, if it's medication adherence, there's been lots of research on it that shows that this can be very effective. You might be interested in saying, well, what can we do with health coaching in a clinical practice in primary care? We don't have a lot of this, but this is one very well controlled study. It was a 2-year randomized study, as you know, that's really good. And I will just say that it had to do with looking at weight loss, but they also looked at, besides weight, it also looked at their glucose levels, and they looked at their different types of cholesterol levels. And they looked at, all the different markers for heart health. And what they found was, in this program where these health coaches were working with individuals in a clinic, a primary care clinic, they could definitely make a difference. And they gave them weekly sessions initially and then monthly sessions. So they didn't have that many sessions, but they really did make a big difference. So it shows us that we can incorporate non-clinical workers in a clinic, really take the weight, the lift off the physicians and the nurses, and help people make a big difference. I don't want to leave out community health workers, so I can just tell you that there is a lot of research that tells us that, and this is from a lot of the folks at the Impact program who are working with our own TennCare here in the state, but they have shown in clinical trials that they can improve all kinds of markers in terms of reduced healthcare services, like the ED room. More people came in for their screenings. They had better communication. They had higher adherence to their treatment plan. So really good stuff for community health workers. And by the way, there's health coaches can work in the community in which they serve, and community health workers definitely do health coaching. So there's a big overlap between health coaches and community health workers. Just some resources for you. I told you about the billing codes. If you're interested in some of those service codes, if you know a clinic or an organization that's interested, you can go to this website and you can find out about it. But it's for non-clinical staff, health coaches and community health workers, that and the MCOs here in Tennessee have agreed that yes, this can be done as long as it's overseen by a physician or a physician assistant or a nurse practitioner, and they can bill for it, which allows them to pay for those non-clinical workers so that it would support itself. There's another webinar about how to add a health coach to your practice if you're interested. It's on our website. And we do have a health coaching toolkit, again, for an organization or a clinic that's looking to hire health coaches. So these are resources that you might, want to provide to organizations or clinics that you know of or may be interested, but say, we don't really know how to get into this. Lastly, what I wanted to do is to introduce you to the training and the certification programs that are in Tennessee. And these are the ones that have been approved by the MCOs for using the billing codes. Now, this doesn't mean that there aren't other good programs in Tennessee. If you know of one and they're not on this list, then feel free to refer them to me, and we can get them in front of the MCOs to approve. The first one is our own program, the one that I oversee. It's the Health Coach Certification Program at UTHSC, and it consists of 2 programs. You take the motivational interviewing program first and get certified, and then there's a second course, the Chronic Condition and Lifestyle Management Program. The 2 together give you the Health Coach certification that's good for 3 years. You're added to our registry, and then at the end of that time, you can re-up it by just taking the competency assessments. You don't have to take the whole course again, unless you want to. The MI program is asynchronous, meaning you can work on it at your own pace. It's online, it's very interactive. It's 10 to 12 hours. Several of the people here have gone through this course. There are 6 modules, and each module has practice activities with a partner. And then at the end, there's a standardized patient activity as your competency assessment. And that's kind of how that works. And then when that program's over, you take the second course. This is also asynchronous. It is interactive, but not as much as the MI program. It's more like an online textbook. And it is also 10 to 12 hours. There's 4 modules to work through, a lot of resources that you can use afterwards. And the competency assessment for that is a case study. And sometimes people will ask me, you know, I'm a nurse, I have degrees in this, but I want to get a certification. Do I still have to take the second course? If someone is that qualified, they can just take the competency assessment and get credit, because this is based on adult education. If you already know the information, you have the competencies, you can just get assessed and you can get credit for that. Are there any questions about this program? For this program, if you have questions about it, and I think, let's see, I think I have a website here that you can go to, or you can just reach out to me. And because you're associated with our program, and you know, you would be considered a partner because you're part of the PAC, and there are some of you from other organizations, we can find you a 50% discount because you're part of our community. So we try to keep the price very affordable. The second program is Vanderbilt Health Coaching Program. Ruth Wolver, I did your mindfulness for you. She's fantastic. She is the director of this program. This one is special because it's approved by the National Board for Health and Wellness Coaching. So if you know someone that wants to be a coach, but outside of Tennessee, our program at UT is really good for someone inside Tennessee. But if you want to be a national level health coach that works in different states, then the Vanderbilt program would be the one that I would recommend. It's very intensive. Phase 1 itself is 8 months. There's over 25 learning modules, peer discussion, and practice. But they do have people that really help you and mentor you along the way. Phase 2 is called your practicum, and you have to complete at least 70 documented coaching sessions. So this is generally better for someone who's already working for an organization as a health coach, in which their organization can sponsor them and can also support them. Amber,
Okay.
do you have a question?
Yeah.
No, she has her hand.
I do.
Oh, good.
I think I know the difference, but how does this differ? I know one is a certification, but how does this differ from being a health coach, a lifestyle coach with the DPP program? And if you are already a lifestyle coach with the DPP program, could you go ahead and just take the certification?
I'm going to let Gladys answer this question.
Sorry. Actually, that's a great question, Amber. You are still considered a lifestyle coach with the DPP. I took that course probably in 2016. And for this one, for Dr. Butterworth, I went ahead and redid it. So I'm still, it's still a lifestyle coach, it's still a health coach. This one is more specific to health, and the other one's more general. It's more, I don't know. They're a little bit different. I absolutely loved Dr. Butterworth. And the reason is that the motivational interviewing piece, it's not part of the DPP lifestyle coaching. And that makes a huge difference to me. I didn't realize it at all until I started really, using it. So anyway, that's the biggest difference is the motivational interviewing piece. That's such an emphasis for the one that UTHSC has. Does that answer
And-
your question?
Yeah, and Amber, I'll add something else. Sometimes people will have a certification that they're really happy with, like the DPP, and they'll come and only take the motivational interviewing. Like, you don't have to take both courses. You can just take what you think will fill in the gaps for what you need or want. So you might say, well, my lifestyle certification is good enough for me. I don't need a health coach certification. But like Gladys was saying, you might find that I want some more skills. I want some more tools in my tool belt for helping to motivate people, for helping them through difficult change. So I'm just going to take that in addition.
So does the health coach program provide overviews of different disease states? Because I know the DPP is pre-diabetes or diabetes. And also, is there a link like to like the agenda of the program and then the certification examination for it? Yeah, those are my two
Yeah.
questions.
So no, these are good questions. So in the chronic condition and lifestyle management program, we definitely do an overview of all the chronic, not all, not every one, but the most common chronic conditions and lifestyle factors. But it's not going to do as deep of a dive into diabetes as your DPP program does. So for someone that's gotten a health coach certification from our program, if they were going to, let's say, join a study and only do diabetes, I would encourage them to go through the DPP. I would encourage them to get additional diabetes information. This is more of a general, I think, as Gladys said, program. If you're interested in looking at just taking the case study competency, reach out to me, back channel, email me. You'll have my email address. You can get it from Gladys. But we'll make sure that we get it to you, because I think I have your information, Amber, somehow, your email. I'll write it down. But anybody else, I can give you a copy of the agenda so that you can get a feel for what the course is about and whether you could just jump into the competency assessment.
And if I can add a little bit more, again, I took the DPP lifestyle in 2016, I think it was, and I just did this one maybe a year and a half, 2 years ago. I don't remember, but that motivational interviewing made a huge impact in the way, not only when dealing with patients, but in your personal life. I mean, the way that you phrase questions, the way you're able to even little things like, if you call somebody, instead of, hey, starting your conversation, hey, maybe is this a good time to talk? But those little things that make a huge difference in your everyday life. So I can't say enough things, and I'm not getting paid. I'm not getting a tip for this, for saying all this. But anyway, it's made a huge difference in health coaching and in my personal.
There may be another hand up.
Yes.
It's me. I don't know why I'm being shown as Gladys. I had a hard time getting on. Hi, everybody. Anyway, I agree with Gladys full-hearted. That motivational interviewing class, the modules where we talked about how you talk to your clients and patients and anybody, you can use it for yourself, but it changed the way I talked to people. It showed me a way that I can get what I need and help somebody along the way, because a lot of times, and people use it. That motivation interviewing training has been tested and found out that it works. So that is something that I feel everyone needs, but especially as a health coach, I know you need that. So that is something you just really, really need. And if you didn't want to take the health coach training, please take the motivational interviewing.
Is this Joyce?
Yeah.
Ah, I
Yeah.
recognized your voice. Yeah, you can actually maybe Gladys can help you on chat, figure out you can change your name on there if you want to.
Yeah, I don't know what's going on with this thing
Sorry.
today. I had a hard time.
So I wanted to tell you about the Vanderbilt Health Coaching Program that, again, this is more for someone already working with an organization who could sponsor you, where you're already seeing health coaching clients. They do include the motivational interviewing as well. So I'll put a big plug in there for them. And Ruth has gotten very skilled at motivational interviewing. There's another program that you may not have heard of, and this is the Preventative Health Network led by Coalition for Better Health. They train preventive health specialists. This is different. It's kind of like more advanced, but they're still doing health coaching. And generally speaking, they tend to be nurses that are working in a clinic. Sometimes they're social workers or pharmacists. They tend to have more advanced degrees. And so if you know someone that perhaps is, burnt out, or they want to have an advanced program in a clinic, this is a way that they can do that. And this is through the content. They take our motivational interviewing course. They work with Vanderbilt. So they're kind of a hybrid of working with different programs. And there's a heavy focus on building competencies and skills that pertain to the health behavior change theory and application. They work a lot with health promotion and disease prevention. They're more, I would say, public health oriented. And this course takes about 40 hours, and it's over 12 weeks. And it's a combination of live virtual trainings with work that you do on your own. So again, these are 3 different types of programs for 3 different types, I think, of professionals. And so we hope that we have enough variety in our programs to where we can meet different people's needs for that. So I've reached the end of my presentation. I want to make sure that I leave time for Joyce to talk about her experiences, but I'm happy to take questions and comments right now. And you can also, oh, and Amber said in the chat that she's had some education in motivational interviewing. So she's had some of that. So that's nice. Yeah. So I am going to turn it back over to, I guess, Gladys. Are you going to introduce Joyce?
Yes, ma'am. Ms. Joyce. Okay. I am thrilled to introduce, of course, we all know Ms. Brown. She's been part of our group for a few years now. She has a BS in business administration, over 20 years of community health worker and volunteer. She is a neighborhood ambassador at Shelby Cares, member of the SEAL Research Advisory Board. So I'm excited to let her give her an opportunity to share with us tonight. Ms. Brown.
Thank you, Gladys, for that great introduction. And thank you, Dr. Butterworth, for allowing me to speak. Oh, I just want to be frank and with everyone. I started my as Gladys said, my career in health. That's not the only job. I was actually in federal government for about 27 and a half years. But what brought me to this place that I felt that I needed to be more instrumental in helping people that needed help and did not have what you might say that income structure or that full access to different health communities and health and doctors and things. Um, when I first started this, we had a group of doctors and we had pastors, lay people like myself, nurses. We got together and we started a little group we called a chart, and it was like a community active group. And we got training from different organizations such as American Heart Association, American Diabetes Association, American Stroke, and the American Cancer Society. So what we did with this information, we would take it to the community. Now, I didn't know about community health workers at that time because this was back in the 90s. So, um, what uh, what brought me to the place where I am now, my daughter Kim found out about this program they had for community health workers, and we contacted Dr. Butterworth and we were able to do the program. Also, I got a job, part-time job with Tennessee SEAL. We were working on the COVID-19 vaccine, which were, I mean, everybody knew about it. We used to see it on the TV every day back in 2019, when the numbers of COVID-19 was so dramatic and people were dying every day of the COVID-19. And so after that, when I got on to Tennessee SEAL, and we went into the community health workers motivation and interviewing, I learned a lot about myself as well as when I'm asking questions about a person situation, their health concern. Now, you don't have to go very far out of your comfort zone to see health disparities, the social determinants of health. You don't have to go very far to see people that may be homeless or without food or without the right type of health care. But you have to have passion, and we can learn how to, because I learned how to um, um, the chronic care diseases. I learned about motivation interviewing. I learned about all of the type of health concerns like diabetes, heart disease. I learned that. Now, one thing that in my heart that you cannot learn, and that is compassion. Being a health coach or a community health worker, which I feel are tied in together, as Dr. Butterworth said, there are very similarities to the jobs that they do. And being a part of the community health workers have gave me the sense of being part of a community, having people to trust me in the resources that I provide from the community resources that I get the information from. It's not anything that I made up. It's always something that's coming from the American Heart Association, coming from the American Diabetes Association. All this information is published in American Cancer Society. This information is public and available to the public. Now, there are people in different areas and zip codes that don't have the access to this information or don't know where to find these resources. And that is where a community health worker or a health coach can come uh, in place, filling that gap between the disparities of health. Somebody might not have access to certain things, and they might have a chronic disease which can be managed, but they might go to the doctor, and the doctor might tell them, and I think Dr. Butterworth mentioned this. The doctor has a way of doing things, and society, we as people have a way of doing our own thing. But when the doctor tells a patient, you need to do this, say for any kind of chronic disease, diabetes, high blood pressure, heart disease, or whatever. The doctor will tell you, you need this, you need to take this medication, you need to do this, and they might give you some paperwork. Now, when that person leaves out of the doctor office, they feel overwhelmed, of course, because now they feel like, some people feel hopeless. And that's where I feel like a community health coach and a community health worker comes into play. When a person is given a diagnosis and they feel overwhelmed, they might start doing what the doctor said, but then, they'll get deterred by some of the, different things that happen, when they're taking certain medications. And so they might stop doing their treatment or just say, hey, I can't do this. So when a community health worker comes into that community and a person get an opportunity to talk to them, they can help them structure or empower the patient to get in line, so much so, or empower them to do what they need to do to be healthy. So they are well needed. And me being a community health worker and / certified health coach, I know well in hand how this practice of motivational interviewing has helped me on my journey of trying to help people in my community or in other communities. We have met people um, from different uh, nationalities. We have met people from different backgrounds, different cultures, people that don't look like me or talk like me or act like me or don't have what I have or whatever it may be. They might see things different. They might not want to, get a vaccine. They might not want to go to the doctor. They might not want to do this. But that's when a health coach or a community health worker comes into play. They can help that person if they want to be helped. If that person wants to come into compliance or come into an area where they can be helped. So I when I was looking on the website for the PAC group, Patient Advocate Service Advisors Council, I saw that with the PAC group, what they do by getting this information, by living their lifelong life experiences through, it could be chronic diseases, it could be heart health, it could be diabetes, it could be high blood pressure, any of these things. When they bring doctors, and when they ask our feedback, which is I can say for Gladys, she always tries to get us what we need, like finding out about foot care if you got diabetes, finding about, you know, uh, uh, plant-based eating, different things like that, which is one of my concerns. I want to know about that. She make things happen. But when we think about the PAC group, patient advocate, you got to think you are already what we call a community health worker because you get this information from the doctors and you spread it abroad. That is the same thing that community health workers do. We get information, be it by publication, different organizations, and we spread it abroad. We want the community to know this is this, these things that we've learned. We want you to take it and implement it. And that is also the job that health coaches do. So I feel that if anybody have even thought about being a community health worker or a health coach, you're already doing it. You just need to get that education behind you so when you tell somebody something that you will actually know what you're talking about, because that's very important. We don't want to take any misinformation out to the public. We want the public to trust us. We want our community partnership to work. We want people in our community to trust us to bring them the correct information and to help them along their way. So just like the proverb, they said, you can give a man a fish and you can feed him for a day, but you can teach a man how to fish and you can feed them for a lifetime. That's what we do as part of this community health worker and as a health coach. We want to teach the public how to get into better health, whether it be a cooking class, which I learned at different places like Sherry Cares. They have cooking classes, they have diabetes management classes, they have uh, different smoking cessation, they got exercise classes. All of this started to get our public involved in getting into better health. So I just commend Dr. Butterworth for this program. I went through the program myself. I enjoyed, I learned, I am better equipped because I went through the program to help my fellow man to get healthy and to know about the different resources out there to help them. Whether it be a food pantry, whether it be a free dental service like what our church does sometimes. Bellevue Baptist has where they come to our church, our clinic. We have a stretch emotional clinic. They come there and they provide free dental care for the community. Now, they do this at no charge to the community. And these doctors, I met them personally. They have a heart of love. So when they do work on the communities, on the people that the patients, they show nothing but love. Everybody comes out with a smile, even though their mouth is full of cotton, they come out feeling, because some of them, they had a bad situation going on, and some of them come out feeling blessed because they got an opportunity to get those cavities and things filled and removed. So I think that being a community health worker or health coach I'm talking to my PAC group. I know some of you, but some of you I've met personally, some I haven't met, but I'm telling you, you already are equipped, but you can be more equipped if you just thought about it. Search your heart and see, do you want to take the next step in being taking the motivational interviewing class and being a health coach and all of that. Think what you can do for your community, for your loved ones, for anybody that you meet, that you can help somebody be healthier. So think about that very seriously. And that's all I have for today.
Thank you very
Wow.
much.
And I didn't even pay her for that. That's amazing.
Thank you so much, everyone. It was a pleasure to be with you, and feel free to reach out if you do have any other questions. Have a great evening.
All right, thank you.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.